Good morning to all. Good afternoon to some. My name is Luis Guillermo Solis. I'm the Interim Director of the Kimberly Green Latin American Caribbean Center at Florida International University. Welcome to this COVID-19 in Latin America, Signs of Hope and Deepening Crisis. Today, we're going to have this exciting program of FIU Insights, one of the series of events covering COVID-19 in the Americas and elsewhere. Florida International University has been particularly diligent in following up this crisis, and with your support and the support of our panelists today, we hope to bring in a new perspective on the crisis that's affecting the Latin American Caribbean region in particular fashion. We have four great women leaders in their own fields that are going to joining us to comment on the virus and how it works. So on behalf of FIU, on behalf of FIU Insights, thank you for joining us. Allow me to give the floor to our first speaker, Dr. Eneida Roldan. She is the Chief Executive Officer for FIU Health, for the FIU Health Network, and Associate Dean for International Affairs of the Herbert Wertheim College of Medicine at FIU. Dr. Roldan is also a researcher, other than her duties as a university administrator, and a very well-known figure in the dealing of the pandemic in the United States. Dr. Roldan, I welcome to the program. The floor is yours.
Thank you so much, Professor Solis, and it's truly an honor and a pleasure to be here this morning, this afternoon, or this evening, depending where you are, where you're listening in from, with this distinguished panel of great women leaders, researchers and experts in their field in such an unprecedented time in our global environment. We are truly living in unprecedented times, and our world in this part of the hemisphere changed in 2020. For some of our global partners, it actually changed very late in 2019. So it's almost going to be now about a year that we would be dealing with this novel virus. So what is COVID-19? COVID-19 is actually the illness caused by coronavirus. Coronavirus is from a group of viruses that we all know. SARS-2, which is what caused coronavirus, is a novel virus, but we all know MERS, which was another global, not pandemic, but global illness, as well as SARS. So therefore, it is from the same group of viruses. COVID-19, the illness, is highly transmissible. It is transmissible from person to person. So therefore, large aggregates of individuals is very, very core. It's at the core of how this virus is transmitted. Therefore, the current armamentarium that we have, the tools that we have to combat this virus is what we all know, which is wearing a facial mask, which provides a barrier. It's social distancing, which prevents the social aggregation of individuals. It is hand washing, and also being able to understand that when you're sick, you do have to be away from the crowds. What is the prevention of coronavirus? The prevention is really the tools that I just mentioned. It is focused on public health measures and not on any type of medication. We do not currently have any vaccines, nor do we have any type of therapeutics that could attenuate the virus and therefore make it less virulent. We do have testing available. As you know, the primary focus of the testing is to get a lot of these different types of tests out in the market. We have heard of the RT-PCR. That's a specific test. Everyone knows it as the nasal swab, and basically what we're trying to identify is the actual DNA of the virus. We also have an antibody test, which detects whether you have been exposed to the virus or not. Not very specific, because you could have been exposed to other types of viruses that has a cross contamination. And then you have the antigen test, which basically detects whether you have the active infection, but if it's negative, we still would need to test you with the gold standard, which is the nasal swab or oral pharyngeal swab that we all know. So what are the challenges that we have in this virus that has actually impacted across the globe 17 million cases? In the US alone, 4.5 million cases, and in Latin America, quite other millions of cases, particularly Brazil, which we're going to hear from today, 2.5 million cases. So what are the challenges that we're facing? First and foremost, it's always resources. Resources of workforce. Our workforce frontline are getting sick, and therefore we have need of workforce to be at the front line to take care of the millions of people that are currently affected by this virus. We also have challenges with supply chain to have kits available to be able to test. The more we test, the more we know how this virus behaves. And also the challenges that we do not know once we have the virus, if we're going to create immunity. We know this is somewhat a short-lived immunity. So therefore the virus is still being ahead of us, not we ahead of the virus. So what does the future hold? The future holds that we have to focus on therapeutics. We may have to focus first on type of therapeutics to attenuate the virus so that it doesn't become virulent and furthermore succumb to mortality, because it's highly causing morbidity across the globe. We need to focus on how we can create herd immunity, which we know that all the pandemics and all the viruses in the past, that is how we are able to combat viruses. Very difficult with this one in particular because the immunity is short-lived. And last but not least is the vaccine. And we know that globally, a lot of our partners are focused on the vaccine, but that we won't see probably in the next year and a half to 2 years. So more to learn. Every day is another day. And this is a very fluid situation. Flexibility, collective action, and personal responsibility are key to be able to be in front of the virus and not behind the virus. So I want to thank you for this opportunity, and I welcome the questions. Thank you, Dr. Solis.
Thank you very much, Dr. Roldan. I remind you we're at an event of the series FIU Insights that we are carrying out from the Florida International University here in Miami. You can send in your questions through our chat, and we will be carrying that to the participants so that they can respond either personally or during the program itself. We're gonna hear from them in a first round of interventions. We've heard the first one by Dr. Eneida Roldan. Now, I'm gonna give the floor to Rebecca Greenspan. Mrs. Greenspan is the Secretary General, La Secretaria General Iberoamericana of the Iberic-American community. She's an economist. She's a renowned Latin American leader, and she is very well acquainted with being an economist with the economic and social consequences of COVID-19 throughout the region. Mrs. Greenspan, thank you very much. Señora Secretaria General, tiene la palabra.
Thank you very much, Luis Guillermo. You didn't say I am a Costa Rican too, as you, and we are good friends since long ago, since we were young. So that's great. Thank you so much for inviting me. And let me start by saying, sadly, first of all, that I'm going to talk about Latin America, not about the Caribbean. That another of the panelists is going to tackle the Caribbean. So I am not going to speak about that subregion. But let me just say that the sad news for us is that this very moment, Latin America is the world epicentric of the pandemic. A very sad indicator of this is that from every 2 new deaths in the world, 1 is Latin American. And we are only 8% of the population of the world. So right now, this is hitting us very seriously and very strongly. My second point is that most governments have taken early action with respect to the pandemic, or in the health space and also in the economic and social space. But still, despite even heroic action from some governments, we haven't been able to stop nor the pandemic, neither the economic and social impacts in the region. So the question is why? And part of it, the uncertainty and the mistakes treating the virus is something that is across the board. But the other reason is that the structural deficits in the economic and social arena that we have not dealt with before are interacting with the virus in the region. So the informal sector in the region, for example, that is more than half of our labor people of labor in Latin America, is a problem right now with the pandemic, because 50% of informality is very difficult to tackle when you have a lockdown, or when you have a quarantine, or when you have social distancing, because these people is not in our social programs. Many of them are informal, but are not poor, so are not into the social programs that were established before. They are very difficult to, and these are people that if they don't go to work, there is no food in the table of their families. So that has, in a way, come as a weakness of our economies to be able, and the governments to be able to deal with the pandemic. The other is our high level of inequalities. And you were mentioned before we started that precisely one of the inequalities is that the access to digital learning, for example, is not available to everybody. And so the poor sectors of the population don't have access to digital education. And we have 60 million girls and boys and young people out of the schools and out of our classes that are, and many of them are not able to continue studying. So structural deficits of the past are enabling the governments to deal appropriately with the pandemic, and so it's hitting us very strongly. So what is the panorama? My third point. First, this will be the worst economic crisis we have ever dealt with in our lifetime. Not even the 80s, that was called the lost decade of Latin America, was as difficult and as hard and as profound as the crisis we are going through. 9.4% of in decrease of GDP for 2020 is a number that we have never seen. 15% loss of formal employment we haven't seen. An increase in the informality from 54% to 62%. 3 million losses in the micro and the middle and small enterprises. And worst, Luis Guillermo, this is very strong to say, 45 million people added to the poverty, below the poverty line. From these 45 million, 26 million under extreme poverty. And we know that extreme poverty in our region means hunger. And that is the social difficult panorama that we are facing for 2020. And we know that it will last, because the other very difficult point is that the crisis that at the beginning was thought to be a short-term crisis have been extended. And so the problems of liquidity of the private sector and the families to be able to face the crisis now are becoming problems of solvency. So short-term problems are becoming long-term problems that will stay with us unless we do something quickly. And so here, my last point is that we need the outside world to be able to face this crisis. We will not be able to do it alone. We don't have the fiscal space to do it. And we are spending 1/3 than compared to the developed world to be able to combat poverty, inequality, and the consequences of the health crisis. So we need the international organizations, the financing world to come in our rescue. We need flexibility. We need long-term financing, and we need it to be urgent and quick and enough. So let me just make a call also to the outside world to be aware, to the IMF, to the World Bank, to the development banks of the region. They need to come quickly with new instruments, with flexibility, with long-term view to help our countries that are not going to be able to face this crisis unless we have the support of the external organizations. And if we don't, so we will go not only into an economic and social crisis, but into a financing and political crisis that can be devastating for our countries.
Thank you very much, Rebecca Greenspan. She is the current General Secretary of the American Community. She was also Vice President of the Republic of Costa Rica and Undersecretary General of the United Nations at UNDP. Now, it is my pleasure to give the floor to Professor Elena Cyrus. Elena is an assistant professor and an epidemiologist at the University of Central Florida, and she is an expert in the Caribbean, health in the Caribbean. She has published extensively on this matter, and she's a renowned researcher. Elena, you have the floor. Thank you very much.
Thank you, Dr. Solis, for your very generous introduction, and also to Dr. Roldan and Ms. Greenspan for such an eloquent and compelling background for me to give my comments. My comments will be a little bit more structured and from a public health perspective. And as Ms. Greenspan suggested, she was talking about the Latin part of the Latin American Caribbean region. And I'm going to focus more on what we refer to sometimes as the CARICOM countries or Anglo-Caribbean region, but also included in that we consider sometimes Hispaniola or Haiti and the Dominican Republic because of geographical proximity. I'm not sure if I had some slides, I'm not sure if they're available, but it's quite fitting to follow on after Ms. Greenspan, because the first thing, if we could just go to the next slide, Andres, this is actually a conceptual model that was adapted from a grant that we have under review with NIH with some colleagues from Istanbul, talking about some of the specific things that Ms. Greenspan just suggested about how the response is so different in that same region, whether it's for the Caribbean countries or the Latin American regions. And so, of course, the public health systems that pre-existed COVID-19 and what those systems look like had a very direct impact on what we see COVID-19 looking like now in these countries, what the incidence and the prevalence are like, or how many cases we have, how many of those cases can actually recover, what number of those cases survive, or what the mortality rate is. And then there's a number of unintended consequences, which I think is what Ms. Greenspan is alluding to when we talk about some of these long-term consequences that we're going to have to deal with in the future that may not be directly related to COVID-19 at this moment, but definitely something that is emerging. And, you know, in this association, there's a number of variables and factors in our environment that can mitigate COVID-19. Some of the things are how we live as individuals, whether we live in crowded situations, what our level of occupational risk is, if we're in the informal sector, if we're essential workers or healthcare workers. And then there are also these macro level policies, I think, which economists and so forth, they allude to, but that can influence our public health response in terms of timing, mitigation policies, what our overall response is. And now as we look forward for the Caribbean region as a whole, what the reopening of our economies will look like and how to do that safely from a public health perspective for populations. We could move to the next slide. So briefly here, we could talk about every country, but I just wanted to give you a snapshot of some of the data for some of the CARICOM countries in the region. To the left of this table are countries that are more affected, and to the right are countries that are least affected. We don't have any countries that are not affected with 0 cases, and maybe in some cases towards the right are countries that people consider to be early models of suppression within the region, so that they were able to put, as the other speakers have talked about, protocols in place early into the lockdown so that they were able to achieve that containment with the imported cases. What we see towards the left of the chart, which is where we have Haiti and Guyana, and we can even probably stick Dominican Republic there, is that they did not do as well in terms of containment of the outbreak towards the beginning of the epidemic. And so what we see happening in Haiti and Guyana, more so than the other countries, is community spread. So more diffuse transmission of the virus without identification of those cases, and it's more difficult to do contact tracing and isolation when you have these types of situations. But the reasons for community spread, there's nuance between each of these countries, and I think as we start to develop policies and so forth to address the region, we will have blanket things, but there's certain things that are unique to these countries. So for example, if you look at Haiti and Guyana is experiencing some level of community spread because of their borders with Venezuela and Brazil, and because of the humanitarian crises that are occurring there and the number of undocumented immigrants that are coming in. And so that is impacting to some level their community spread. And the same thing can be said to some extent for Haiti and Dominican Republic. With regards to the other, let's say, Anglo-Caribbean countries, they've been able, I assume because they're islands and they're sort of landlocked, to close their borders for air, land, and sea. They don't have land borders where people can walk over, so their containment is easier to do. And they were able to implement very quickly strict protocols. As a matter of fact, to my knowledge, Jamaica is one of the few countries in the region that has an electronic tracking system for contact tracing. We can move to the next slide. This is just a quick slide to show you. This is from Dr. Christie from UE Jamaica Mona, showing how much of our economy is dependent on GDP and tourism. And if you go to the next slide, this becomes important because one of the big considerations for us will be border and immigration control, especially as it turns out for health. And when we talk about border and immigration, we're not talking about just unidirectional from, let's say, the US and North America into the Caribbean region. But for us, especially for those who work in Florida, there's bi-directional immigration issues to consider in terms of health outcomes and community spread. And so these are things that have to be considered. As I mentioned, Jamaica has an electronic tracking system that used to be working for them. And as economies try to reopen, they're actually trying to think of more novel approaches to reopen their economies that will be safe and protected. So for example, Barbados is now issuing visas to Canadian citizens who are working remotely because of COVID-19 to live in their country for 1 year once they pass certain health precautions and requirements. But this way, Barbados can reopen their economy, regenerate revenue, but do it, in their opinion, in a safe manner for their population. Next slide. And these are some of the unintended consequences. Now, this I developed specifically for the Caribbean region, but I think that you can actually apply this throughout the Latin American and Caribbean region. I worked in Peru for 2 years. I know the South America region just as well as I know Caribbean, and I know Florida well too. And I think these unintended consequences can be applied not just for our region, but globally. Many of us in HIV research have now gone over into COVID-19 research, and we draw upon a lot of the lessons that we learned in the HIV pandemic to explain some of the things that we're seeing now in COVID-19. And one of those theoretical models that we use is something called like a syndemic theory. And what that means is that there's a confluence of factors occurring in a community that lead to a very negative outcome. What we're seeing now is with COVID-19, an increase in gender-based violence, especially against women, increased levels of stress, which is leading to substance use. And we're also seeing a distraction from other health concerns and humanitarian crises that we needed to focus on because all of our resources are sort of being outsourced to COVID-19. The next slide. I think right now, as we look towards the easing of the lockdown or the reopening of the economy, what we really need to do, as the other speakers have spoken, is to be original and novel about our approaches and to think outside of the box about things that we're not even thinking of that are directly related to COVID. One of the things that some of the CARICOM countries are doing is that they're actually participating in the WHO Solidarity Trial, which is one of the trials that will be looking at treatment lines. And I think this helps us because by then we'll get like almost more of a chance of a technology transfer of those therapeutic lines from the north into our region, into our countries. The next slide, I think, yeah, those are the main points that I want to highlight right now. And these are just all the people that I work with within the region that helped me get all this information together, to give them a big thank you. And I think that's it for my debrief.
Thank you very much, Dr. Cyrus. This is Elena Cyrus, an assistant professor and epidemiologist from the University of Central Florida. She's also an expert in the Caribbean. And we will be back to our panelists in the second round once we have heard from them and seen them in the rest of this program. Now I'm going to give the floor to Professor Simone Ataige. Simone is an anthropologist. She is a professor here at the Kimberly-Green Latin American Caribbean Center, and she's also an expert on the Amazon Basin and indigenous peoples, which, as we know, is one of the most affected sectors in the Americas, indigenous peoples. So, Simone, you have the floor. Thank you very much for joining us.
Thank you very much, Dr. Solis, and thanks everyone for being here today. It's a great pleasure to be sharing this informal event with all of you. And I would like to have my presentation loaded. I'm going to be focusing on three main aspects today on the situation of COVID-19 in Brazil specifically. I'm going to start with a brief overview of the situation right now and the public health, political, economic, and social crisis we are facing in the country. Then I'm going to talk specifically about COVID-19's impacts on indigenous peoples, impacts and responses on indigenous peoples in Brazil. And I'll conclude with maybe some reasons for hope in some fronts that I would like to share with you. So first of all, we have now a deep crisis in Brazil. We have around 90,000 confirmed deaths and 2.5 today, you know, every day. It's like there is a jump on cases and a jump on confirmed cases and deaths. So 2.5, around 2.5 million registered infections, and it's second only to the United States. So it's the country that has been most hit by this virus in the whole Latin America. It's also the largest country with the largest population. But what are some facts and factors underpinning this grave crisis we are facing in Brazil? And one of them is the government's response to this virus. It has been very inconsistent. We have had a lot of problems with health ministers. It's been changed, stepping down and replaced by others. So we don't have a consistent response from the government. And this is mostly at the federal level, with current President Bolsonaro has been accused of really downplaying the seriousness of this crisis, and has been accused to be incompetent to address the current crisis. A group of unions and social organizations representing more than 1 million medical professionals have filed a complaint to the International Criminal Court in Netherlands, accusing President Bolsonaro of committing a crime against humanity, and including genocide against indigenous peoples. So we already had a very poor public health system in the country, and this has been exacerbating by the response to this crisis on the public health sector. There is a lot of also miscommunication, as you know, on this crisis, on this virus, on the effects, on how to protect yourselves, if you use or not a mask, and things like that should be regarded as simple guidance that the government should be providing to the citizens, but has failing to provide that needed guidance. So what we have now in Brazil is a very divided country. We have a divided country with political views. We have a divided country with perceptions and responses to this virus. So we don't have a cohesive societal response to the virus, which is aggravating the crisis. Of course, unemployment is very high, so we have a deep economic crisis as well, and environmental crisis, which I would love to talk more about that to you today, but I'm gonna focus instead on the situation on Indigenous peoples. Next slide, please. And so in regards to Indigenous peoples, so we have roughly 150,000 Indigenous peoples in Brazil, and they are the sector of the population that is most vulnerable, as Dr. Solis highlighted, to this crisis, to this pandemic. Yesterday, we had around 20,800 cases confirmed, almost 600 deaths, Indigenous people's deaths. A lot of them are elderly. So you can imagine how much wisdom and knowledge has been lost in the country with these deaths of elderly in the villages, and 145 affected people. So one of the conducts of this infection in Indigenous lands is the entrance of you name it, any entrance of outside agents, health professionals, miners, and mining is a huge problem in Yanomami territory in the north, as well as missionaries and just intruders bringing the disease, as well as Indigenous peoples going to the city to look to buy food and access the health system. So there is a huge crisis because Indigenous peoples are more vulnerable, not only economically, but in regards to access to public health services, and also because of their coexistence in a more collective way is against the protection and prevention that Dr. Roldan talked about in the beginning of this discussion of this symposium. So one important aspect is also that President Bolsonaro just recently vetoed parts of an important law, an emergency plan to address the coronavirus threat to Brazilian indigenous populations, including basic and very essential services such as access to drinking water, free distribution of hygiene products, and access to public health as well in the municipalities that are connected to the indigenous lands. So the government is being accused of genocide by several indigenous organizations and the federal indigenous organization, APIB, several times. One of the things that is important, I think, to highlight is the Indigenous peoples led initiative. So the response of Indigenous peoples, the agency of Indigenous peoples to address this crisis. And there have been registered more than 100 initiatives at the local, regional, and federal scales. Finally, in regard to Indigenous peoples, I want to make a remark of the incredible leadership that we have had of Indigenous, specifically Indigenous women that are on the front lines of fighting this virus politically and also bringing consistent message to Indigenous populations, and specifically at the federal scale. Sonia Guajajara, that is the leading APIB, the National Indigenous Peoples Organization, and my friend and deputy Joenia Wapixana, an Indigenous lawyer and the first Indigenous Congresswoman in Brazil. So she's there on the front lines as well. I also want to highlight some important message from Indigenous leader Davi Kopenawa. So all these Indigenous leaders are stronger now with a strong presence online, which is very interesting to observe. And he says that all this destruction is not our mark, is the white's footprint and your trail on the earth. So I just want to conclude now with the final slide with some reasons for hope. So of course, we are hopeful for more anti-COVID drugs that will help to lessen the impact of COVID-19 on everyone and also the most vulnerable populations. Of course, we are all looking for a vaccine that is accessible to all, but Dr. Roldan just highlighted that that might not come anytime soon. But we need to rely more also on mayors and governors' leadership. If we don't have the leadership at the federal level, indigenous organizations and indigenous leadership to face this pandemic, alliances, internal, external, international, as Dr. Greenspan highlighted as well on her presentation, compliance, individual and group compliance. I think it's very important also when the church and the religious movements are more consistent addressing this crisis, something that we could even have a symposium only on that. There was a recent letter signed by 154 bishops in Brazil addressed to the world on this, the aspect of the Brazilian crisis, and the very, very active participation of the public prosecution service in Brazil and the justice system. And then I just want to conclude with this internet movement that's been very, very inspiring. We have all these lives now in Brazil. Every day there is a list of lives you can access, and a lot of them are campaigning for fundraising for communities, indigenous and local communities, to address the crisis, and also even decolonizing our thought about any stereotypes that we might have about indigenous peoples with the Ninja University that indigenous peoples themselves teach about their culture to the outside world. And I think that's some reason for hope and inspiration for us. I think that's all I wanted to share today. Thank you very much for your participation.
Thank you very much, Professor Simone Ataiche, professor here at the Latin American Caribbean Center at FIU, an anthropologist who's spoken about one of the most complicated cases in the hemisphere, Brazil. And now allow me to give the floor to a representative of the Uruguayan case, Dr. Karina Rando. She's the Director General of the Ministry of Health in Uruguay, which, as we know, is the country that has been acknowledged as the one that has been handling the pandemic better in our hemisphere. So this is a case that needs to be known. And I would like to thank the Consul General of Uruguay here in Miami for making us the contact with Dr. Rando. So you have the floor, Dr. Rando. Thank you very much for joining us. I don't know if she's in. We lost contact with Dr. Rando, Karina Rando. Well, let's move on, and we'll have Dr. Rando whenever she can join us. Due to technical problems, she cannot join us now. Then I would like to go back to Dr. Eneida Roldan. In the minutes we had before we started the formal presentations, we were talking about another pandemic. And you were very forceful in putting this forth, Dr. Roldan. Can you tell us, please, what do you mean by the next pandemic? And why is it important that we talk about the consequences of this pandemic in the next round?
Absolutely. Thank you, Professor Solis, again, for the opportunity. What I was talking about is the next pandemic is mental health. We understand that the tools that we currently have now, which we alluded to, is the facial mask, it is the social distancing, and it's really social separation, because it's not just when you are with the individual close, and it could be no close than 6 feet, but families are separated. Families could be separated because let's say they might have to, they succumb to a death. They can't even see their loved ones at the last days of their life. They can't even visit their loved ones in hospitals. Children are separated from their friends because they can't go to school. Teenagers, adolescents, it is so important that those years for socialization, they have now been prohibited to be in groups because we understand that this is a highly transmittable virus. Although they could be affected, and we know that there's vulnerable populations more than others, but again, this is a virus that does not determine whether they're going to affect the youth or they're going to affect the elderly. We do understand that the elderly are more vulnerable. Those that are immunocompromised are more vulnerable. But then again, we can find those groups in our youth. So therefore, they are now being separated. They cannot socialize. They cannot congregate. So that type of constraint is what is important for human behavior to grow, to feel supported, to feel nurtured, and to feel loved. So therefore, we know that currently there is an increase of substance abuse. We were having a pre-conference conversation with the use of drugs, highly over-medicated. People cannot sleep, therefore they use medications to sleep. They substitute that part of lifestyle with either drugs and or alcohol. And all that is in alignment with the potential of an increase of a huge impact on the healthcare system across the globe of mental disease.
Thank you very much, Dr. Roldan. We now have Dr. Karina Rando. She is, as I said, the Director General, the Ministry of Health of the Republic of Uruguay, the country that has handled the pandemic more successfully. And she is part of the team that has made this possible. So I want to welcome her and give her the floor for her initial presentation. Dr. Rando, please go ahead.
Okay, thank you very much. Thank you for inviting me here. It's a pleasure to be with you and to share our experience with the countries that are present here and any other that would like to share experiences with us. I think that one of the most important thing that we have done for control the pandemic, the way we have done it, is that our government act immediately when the first 4 cases appear in the country. We would like to remind you that we assumed this government on March 1st, and the first case was on March 13. So we were really a brand new government, with most of us with no experience as political. And so really it was a huge challenge for most of us in the Ministry of Health, and of course in all the government. I think that the main thing that we have done is that immediately we react, including and making join what sanitary actions were and science. We immediately start to work with the academical area, with the university. And as in all the world, there was a lack of resources to make PCR tests. We decided to create our tests. And in all this time, in these months, we have developed 23 laboratories that can detect the virus by PCR technique. That is a lot for a country that has only 3,400,000 of people. So it's less than 4 million people. And we have a possibility of testing that is really very high. That was one of the paramount things. The other things that I would like to tell is that in our country, there was not obligation of staying at home. There was not punishment for not accepting the rules. Our president decided that our population would choose, and really the population choose a responsible freedom. And that responsible freedom was promoted by advertising in all the media. And it was really good. At the beginning of the pandemic, most of the people that didn't need to go to work stay at home. So it was easy at the beginning to identify the new cases, to trade and to continue searching for the contacts, and let the contacts stay at home, test them again. So every contact was only The only people that was really obligated, I'm very sorry, the only people that was really obligated to stay at home was all that people that was positive and that was near contact to the positive. The rest of the population, they were allowed to go to work, and there was not obligation to use mask, even though it was hardly recommended. So one of the paramount things was the freedom, the responsible freedom, the working as a team, sanitary actions and scientific actions, the development of laboratories, and then the information was also paramount, and the dividing the country in 19 regions. Our country has 19 like states, and the Ministry of Health is working in every 19 states, even though we are all connected by the direction that I am the head of. We are all working together. So when we have cases in one of the states and the people who was searching for the contacts was not enough, we send another team, and every new case was searched until the end, the first, second, third, fourth circle. Is this okay? Do you understand this? Every cases was totally follow until the fourth cycle of people, and that happened in all the patients, in every case, in all the country, in the 19 areas. So I think that the testing and the follow-up of the patients was really very, very well done. And that was, I think, the most important measure that the most important strategy that we had in our government. That is from the sanitary, from the medical point of view. The other thing that was very important is that we were very well prepared for the crisis, because the first thing we did when we assumed the government on March 1st was to ask the providers, the service providers, the hospitals, the emergencies, to increase the ICU bed numbers. So we increased our ICU capacity 40%. We bought, as a Ministry of Health, we bought 150 and then 200 ventilators, respiration or anesthesia machines that were distributed in all the country with a very low rate, with a very low price for public and for private services, health services. So at the beginning of the pandemic, we had a very well testing system, a very well follow-up system. We have a unique health system that works together, and we have an intensive care unit capacity of 40% extra that we always have. And the other important part was that the government did not close all the country. So the economy, even though was slow, was not at all stopped. So even though we have unemployment is not very, very high numbers. And then after that, well, even though in that moment we were so comfortable in management of the crisis that we received the Greg Mortimer vote, and we have the enough capacity in our services to give assistance to the more than 300 or 400 people that were on board in the boat. And then we disembarked them in the country, and we were able to test all of them, to give them follow-up, to give them ICU when they needed. So the crisis was really under control all the time, from the beginning to the end. Then That was from the point of view of the sanitary and sciences. And then the other thing that we have done, we prepare in every one of the 19 states contingency, they were not hospitals, they were like contingency houses for those people that need to be quarantined, need to be isolated, but did not have or do not have a place to stay because they live in a house that they could not be separated from the rest of the family, or because they came from Argentina or from Brazil or for any other country asking for assistance as a refugees. We didn't lock the country for refugees. We locked the country for most of the countries for foreign people, but we made a very, very successful program of bringing home all the Uruguayans that were outside the country. Well, that was a huge, huge program that was made in cooperation with the Ministry of External Affairs. So we bring home most of the Uruguayans that were all around the world. And then we also allowed to come inside the country those people that were refugees. That was a problem at the beginning, even though there was another problem with the people that come inside the frontiers. That was the people who were working in the trucks. We receive in Uruguay more or less 2,000 trucks a day for the industry to be able to continue. And we didn't stop the industry. So we still receive all that people from Brazil, from Argentina, and from Chile. All of them have a very, very high rate of infection. What we have done is we place test centers in every point of migration and frontiers. So what we are doing now is we are testing every truck driver that is coming inside the country. We test them, we let them go and do the work. And if the test is positive, we follow up in less than 24 hours and we quarantine the truck driver and isolate it. So, I mean, our strategy was very strong in the follow-up, was very hard in the economic point of view from the government, because we are paying all the tests. We have put in work all the laboratories, and the government is putting a lot of money in financing the public and private providers. But that allowed people to not be totally isolated. People could continue doing their most important activities. Families can be together, so that the depression and all that mental health issues that we can see in other ones, in other countries, is not the rule in Uruguay.
Thank you very much, Dr. Rando. Allow me to just make a cut here from your presentation. I will come back, but allow me to do another round for the other participants to wrap up their presentations, if I may. Mrs. Greenspan, can you please elaborate a little bit what you meant by international intervention, and particularly in the financial sector? You mentioned a number of institutions, the IMF, the World Bank, the regional banks in Latin America. What do you mean by that?
Well, first of all, we need that the special drawing rights will be a new emission of special drawing rights in the IMF will be allowed by the board. That happened in 2008, but it hasn't happened now. The G20 in the crisis, in the financial crisis of 2008, acted very quickly, but now we are seeing that the IMF is the central bank of the developing countries, because we don't have the European Bank, we don't have the Federal Reserve. So the liquidity that these countries need to overcome the crisis is not there unless we have two things: special drawing rights from the IMF. So the IMF will have the liquidity for the developing world. Second, we need to capitalize the development banks, because we need to invest in the sectors, in the SMEs, in protecting people, in the health sector, and that will have to come from the development banks. And the third thing we will need is the developed world, the rich countries, to give away their special drawing rights for the developing world, because they don't need it. And because the financing is assigned according to your participation in the financing institutions, they will get most of the liquidity that they don't need. So what we need here is solidarity, we need cooperation, and we need coordination of the financing world, so our countries can have the instruments they need to do what we need to do to protect our people and get out of this crisis without more poverty and more inequality.
Thank you very much, Mrs. Greenspan. Allow me to get Simone in, because she has to leave, unfortunately, to attend another event. Simone Ataíde, a professor here at FIU. You mentioned the dire condition, Simone, of the indigenous peoples in Brazil. Some people, as you mentioned, some organizations have brought President Bolsonaro to the international justice system, accusing him of crimes against humanity. Would you go as far as to assert that there is genocide occurring in Brazil, or is this going too much into the discussion, bringing a concept that's in the international law system, but that can be excessive sometimes to describe the situation that the indigenous peoples in the Americas are suffering?
Yes, thank you very much, Dr. Solis, for this question. I think it's very important for us to reflect. This is an unprecedented crisis, right? We don't have a record of the crisis, but we do have a record of what happened in previous pandemics and how it decimated indigenous peoples across Americas, across Latin America in the past. So we do have that memory that's been written, has been documented. And what, in my perspective, if you know how to address the situation better, and if you have the conditions and you decide not to address for maybe political reasons, it's a trail of actions that will enable you to be viewed as someone that is actually acting against your own indigenous population. And if you are acting on purpose to disempower the indigenous populations and to make them even more vulnerable than they already are to these pandemics and public health crisis, then is it has been called a planned genocide, because you are purposely acting against these populations through discrimination and not implementing the measures that you could implement at hand on purpose. Then I believe, yes, you could be framed as genocide. But this is my perspective. There are so many different perspectives. I'll be happy to listen to some of them from the audience.
Thank you very much, Professor Simone Ataíde. We wish you well, and thank you very much for having joined us this morning. I would like to go now to Elena Cyrus. Professor Cyrus, was there a role for the CARICOM? You mentioned the CARICOM in passing, but I wonder, Mrs. Greenspan is the head of a regional integration organization. Is CARICOM part of, has CARICOM played a role in the pandemic management in the Caribbean?
Yeah, to my knowledge, and Ms. Greenspan can correct me if I'm wrong, but similar to what's happening in the US, the response is sort of fragmented or decentralized. So certain countries within CARICOM are doing some things, but they're not all working together. So for example, I think Jamaica and Barbados and Trinidad are part of the Solidarity Trial, which was facilitated through PAHO and CARICOM, and eventually to WHO, but I don't know if all of the other islands have that much access. And I think one suggestion or recommendation that I would have is that, and this is not just for the region with CARICOM, but in general, globally, that we need more collaboration, more cross-border collaboration, especially as we go through the scientific process and developments. And one of my major concerns as Dr. Roldan speaks about, the things that are coming down the pipeline, they're very promising candidates in terms of vaccines and therapeutic lines. My concern is that equitable transfer of those therapeutic lines into the LAC region. And then once it gets into those countries, that it's equitably distributed within the population. Because, for example, with vaccines, we will not achieve herd immunity if there's not a certain level of uptake within those populations. And so in addition to everyone sort of working together, I think the other important thing that I would recommend through CARICOM and through other regional governmental bodies is to get the buy-in of the community. We can't continue to work separately scientifically on the side and expect that these things will automatically be uptake, that there will be uptake in these communities if we don't work with them and sort of understand their needs and what it takes to have these things implemented successfully. So my two recommendations for CARICOM and for governments within the Caribbean and within the region is basically one, that there should be an open and transparent stream of scientific information, technology, and communication going across borders between researchers and scientists in general, and also to empower and value and really respect the role of the community as we start to address this pandemic.
Thank you very much, Dr. Cyrus. Dr. Rando, one of the most unfortunate things that we've seen in other cases in the region, including the United States, including Brazil, is the politicization of the partisan politics that have accompanied the handling of the pandemic. As far as I have read and I understand, in Uruguay, there is a bipartisan approach to the handling of the pandemic. I mean, a new government did not neglect what the previous government had done, and the opposition to the current government has joined the government in supporting the handling of the pandemic. Can you let us know how this happened? It's virtuous association of political forces that made it possible to have a bipartisan or a multi-partisan approach to the crisis. I think you're muted, Dr. Randa.
Sorry.
Thank you.
I think, yeah, that's true. It's absolutely true what you have said. We assume the government as a coalition of different parties, political parties, and there was the opposition. We had, even though, cooperation from the opposition. So most of the political parties of the country were involved in the government. So we all were working as one. And the opposition that was outside the government did not make things difficult. They also help us working and doing things as we think they need to be done. That was in part, I think, because Uruguay is a small country, and the people were very conscious that in one of the paramount things that we learn when we are managing crisis is that political parties cannot be inside interfering the politics to afford the crisis. If you start to working individually as different political parties, then you would never be able to control the crisis. That is the first thing you learn when you are going to manage crisis or when you study managing of crisis. We talk that at the government, at the highest level with the president and with all the leaders of the political parties, and we all agree that there was not going to be fights between political parties until this epidemic or pandemic finished. So nowadays, to wrap up, we have in a country of 3 million people, we have only 967 patients that were infected and recovered, and 237 that are infected and still with the disease. But we only have 24 patients hospitalized and 7 patients at the ICU. That's a very good thing. We only have 35 patients that have died, and we feel that even though it's getting harder and harder because of the frontier with Brazil and Argentina, there are 4 paramount things. I'm going only to describe them, mention them, and then I finish. One is that we have a unique national health system. That is very important. Second, we have preparedness for this crisis. We prepare the system for this crisis. Third, we have done a very well coordination between all the countries. In 4, we involve the population in the care of themselves. 5, we didn't stop the country. We only reduce the mobility as much as we can, but we did not stop the country. And then the most important, as that's what I think, is the epidemiological follow-up that we are still doing in the country. With all that measures, we think we are doing our best all together, all the different political parties, and I think that is the clue for this success. I'm talking today because maybe tomorrow or in 1 week is not going to be a success, but today we feel comfortable with the way we are doing.
Well, thank you very much. I think that there's one more factor that you did not mention, and I would like to bring it to the forefront, and that's scientific research.
Oh, and scientific research.
You've done extraordinary efforts to bring forth that as an important factor. It is also happening in my own country, in Costa Rica, where universities have joined in an effort to do a lot of new research for the treatments that are now available. We're unfortunately out of time. There's been a very good participation in the audience, and you have been sending the panelists your questions. They will be taking care of them. But I would like to take this opportunity to thank them all. These are 5 extraordinary women leaders from different countries in the hemisphere who are doing their part in handling the most challenging pandemic in modern times. So I'd like to take this opportunity to thank again Dr. Neida Roldan, Mrs. Rebecca Greenspan, Elena Cyrus, Professor Simone Ateje, and Karina Rando for their wonderful presentations. And also thank you for joining us in this new FIU Insights. On behalf of FIU, President Mark B. Rosenberg, Dean John Stack, the team at our School of International Public Affairs, Amy Ellis, Pedro Ota, thank you all for your technical support and for your continuing interest in this issue. And let's ask ourselves what we're doing personally and socially to contribute to the handling of this pandemic. There's lots of things we can do. Volunteer work, and certainly taking care of ourselves and of our families. Thank you all very much. Have a great day, rest of the day, and be well.
Thank you very much.
Well, thank you very much to all.
Thank you.
It was excellent.
Bye-bye.